Thank you.
Judge, may she be excused from her subpoena?
No.
Thank you, ma'am. You may step down. All right. You may call your next witness.
Thank you, Your Honor. The state would call Dr. Kohr. Your Honor, may we approach?
Sure.
Sidebar conference conducted.
This may be a lengthy witness.
Do you want to take a break? Is that what you're asking?
I'd be fine to proceed, but
We may have to break between direct and cross.
Yeah, I don't know how long it's gonna take, so I'd.
All right. We'll kind of play it by ear.
I probably could use a restroom break. I'm okay though?
Okay. All right. Maybe between direct and cross. Okay. Thank you.
Sidebar conference concluded. Witness sworn.
good morning, sir.
Good morning.
Would you tell the jury your name, please?
Dr. Roland M. Kohr, Kohr.
And can you tell the jury what is your profession?
Currently, I'm a semi-retired forensic pathologist. I do fill-in work still to cover autopsy services for my former associate. I do independent consulting with civil and criminal attorneys in various other jurisdictions in various locations across the country. I am also the forensic medical director and laboratory director for the Indiana Donor Network.
What does a pathologist do, sir?
Pathology is a subspecialty of medicine or a specialty of medicine. Literally, the word pathology means the study of disease. A typical pathologist in most hospital settings would be the person that oversees the laboratory, that looks at specimens under the microscope, examines things removed at surgery, who's responsible for ensuring that blood tests and urine tests, things of that type, are run properly and accurately, and then just overseeing the lab functions according to governmental standards.
A forensic pathologist. Would you describe that for the jury, please?
Certainly. Forensic pathology is a subspecialty of pathology, of which there are several. The basic hospital pathologist is usually considered an anatomic pathologist and a clinical pathologist. Forensic pathology is an additional specialty subcertification that applies the principles of pathology and medicine to the field of law, so as to make interpretations available to examine causes of death, injury patterns, things of that nature.
Would you describe your educational background, please?
Following high school, I attended Indiana University in Bloomington for 3 years, receiving a Bachelor of Arts degree in Biological Sciences. I then attended the Indiana University School of Medicine in Indianapolis for 4 years, receiving my MD degree. Following that, I did a 1-year general surgery internship at Methodist Hospital of Indianapolis, at the IU Medical Center, and then a 4-year anatomic and clinical pathology residency at Methodist Hospital of Indianapolis.
What did that residency and the last 4 years you said was a what?
Combined anatomic and clinical pathology residency.
Residency. Would you describe for the jury what that consisted of? What was your experience in the residency?
Okay. A resident is, basically, an apprentice position that's learning the ins and outs of a given specialty. So during the 4 years of that training, I spent 2 years in clinical pathology, 2 years in anatomic pathology, getting gradually increased levels of responsibility. So on anatomic pathology, we would examine specimens as they were removed at surgery, whether it be a gallbladder, a colon biopsy, entire organs removed, such as breasts for breast cancer or colon for colon cancer. That also included autopsies and, during the course of my residency, did in the neighborhood of 150 to 200 autopsies. The clinical pathology side of things involved looking at the basic laboratory operations, so we were experienced in clinical chemistry, clinical microbiology, hematology, blood banking, toxicology, coagulation, things of that nature, and again, you're given increasing levels of responsibility, shadowing established head positions until your final year you're kind of given almost free rein, but still with somebody to oversee, making sure you're not overstepping and misdiagnosing things.
After completion of the residency program, what did you do? What was the next phase of your profession?
I received a job offer and took a position as an associate pathologist at Terre Haute Regional Hospital at Terre Haute, Indiana, where I served as the associate pathologist to a more senior pathologist for 9 years. Following those 9 years, the hospital board of trustees appointed me as the director of laboratories over my previous supervisor, and I remained in that position as director of laboratories for the hospital up until my retirement from full-time practice 3 years ago. During the time I was a pathologist in Terre Haute, I was encouraged by various entities to consider running for coroner based on my experience on having done autopsies and understanding disease processes, and so, during the course of the 1988 election cycle, I ran for and was elected as coroner, taking office in January of 1989. Since that time, I served a grand total of 4 terms of 4 years each as Vigo County coroner. Because Indiana law limits constitutional offices to 2 consecutive terms, I did 2 terms, set out 2 more, then ran for 2 more terms, but continued to do autopsies for the Vigo County Coroner's Office and, eventually, for 16 or 17 other counties in the area, including several in Illinois.
Dr. Kohr, I'm not sure you covered it or not. Did you have a time where you did emergency room medicine?
Part of my training in general surgery was stints in the emergency department at what was then called Wishart Memorial Hospital, the county general hospital for Indianapolis, but then, because of that and my general surgery experience while I was doing my pathology residency for those 4 years, I had a moonlighting position where I worked as a ER physician, basically did.
Have you been a teacher?
I have.
Explain that for the jury, please. What teaching experience do you have?
Well, as a medical resident, you've involved with teach-in-G of medical students that do clinical rotations on the course of the things they do in a medical center setting. But after becoming coroner, I was approached by faculty members at Indiana State University who were interested in me teaching a course in DADH investigation in their criminology department, so I ended up teaching for roughly 20 years with a title of Associate Visiting Professor of Criminology and Criminal Justice, taught a 3-hour course, 400 level and 500 level, so it meant upperclassmen, as well as graduate students, on basics of death investigation. Since then, I've also served as an instructor for the Indiana Coroners Training Board for roughly 10 years. As a pathologist at the hospital, we also have medical students that rotate through at various times, so we would entertain students for month-long rotations, basically one-on-one, them shadowing me for the course of the month. Above and beyond that, I've always made it available that law enforcement officers, others in training for things such as paramedic/EMT, could attend autopsies to learn the basic anatomy. And I've had relationships with several of the nursing schools in the Terre Haute area. In fact, as recently as 2 days ago, I had nursing students observing one of my autopsies, so I'm still teaching, just not with a formal title and not getting paid for that part of it.
Have you been asked to provide any leadership, sir, in any?
I have. I was appointed to the original Indiana, what's the exact title? Child Fatality Review Team, which was back almost 20 years ago. It was formed and was one of the original members of that group. We review, essentially, every childhood death that occurs in the state of Indiana. After about 7 years in that position, the governor at the time, essentially, cleaned house and named all new members, but as of about 5 years ago, I'm back on that committee, so I'm serving as the lone forensic pathologist on the State Child Fatality Review Team, as well as 2 subcommittees of that, one of which is the Sudden Unexpected Infant Death Investigation Subcommittee, and then an advanced review team composed of myself, some geneticists, and multiple specialists from Riley Children's Hospital, as well as Department of Health.
Over the years, have you collaborated with the Indiana State Police in providing training and teaching to crime scene investigators?
Well, by the nature of the way I do autopsies, I'm always trying to teach while we're going through things, because various people see certain situations infrequently during the course of their careers, and so whether it be city police, a town marshal, county sheriff, or state police, I'm always kind of go into teaching mode if we see something of interest during an autopsy. Because of that, for a time, the person who was in charge of training of crime scene investigators or evidence technicians for the state police, who had been one of those himself, started sending all the recently trained and ready to enter practice, as such, graduates of their program to me, and I would spend basically a half day with them, primarily to describe how they are to interact with county coroners, because county coroners in Indiana have a great spectrum.
You mentioned your coroner experience, Dr. Kohr, and that would have directly led you to visit and be present at crime scenes, at death scenes. Is that correct?
That's correct.
Many forensic pathologists confine their work to simply the laboratories. Is that correct?
It's correct. Part of most training programs though requires that the pathologist, the forensic pathologist in training, do attend some crime scenes just to understand what goes on, what takes place. When I became the elected coroner, until I was confident in the abilities of some of my appointed deputy coroners, I would go to most of the major scenes myself, not necessarily to every natural death, but if we had something unusual in particular. For the first several years, I attended every single homicide and, fortunately, since Vigo County does not have an overwhelming number of homicides, like a Marion County or a Chicago area, I still kind of made it a point, whenever I was available if I was in town, if we had a homicide, I would attend it just because, based on my experience, training, etc. Sometimes I see things at scenes that other people don't or, if they see them, they don't recognize the significance of, so that extra set of eyes is always helpful because it may be something that nobody else felt was significant.
What is an autopsy, doctor?
The word autopsy literally means to see for yourself. In common usage, it is a medical examination performed by a medical professional which involves external and internal examination of a human body, although it rarely can be similar things done for animals. It involves collect of evidence as necessary, removal of the organs, dissection of the organs, collecting of blood samples and other body fluid samples, preservation of samples for further examination under the microscope for looking for microscopic changes, and then submitting samples for toxicologic or other chemical testing, and then putting all those bits of information together to render a final autopsy report with an opinion as to the cause of death and, based upon the circumstances provided to us, as to the manner of death.
My next question, you probably covered it, but I want to make sure I understand the sequence. When you perform an autopsy, what are the phases or stages of the autopsy?
Okay. Well, I kind of gave a brief overview. The initial stage we do before doing any autopsy is, A, we have to be contacted by a legal authority requesting the autopsy. Now, when I was coroner, I was my own authority, so that was not an issue, but when I've not been seated as the coroner, that has to come from either the coroner or a deputy coroner and, for all the other counties I worked with, from the representatives from their particular offices. But they would contact me, indicate their interest in having me perform an autopsy, and then we would make scheduling arrangements to work it into whatever the workflow was. I would try to get as much possible information relevant to the case about why we were doing it to start with, and then, at the appointed time, we.
Let me stop you there, Dr. Kohr. We'll talk in a bit about the exact components of the Indiana State Police Evidence Collection Kit, Sexual Crime Collection Kit, but that process of examination and collection of samples is done prior to any real movement or touching of the body, certainly any cleaning of the body. Is that correct?
Well, things such as collecting hair samples, fingernail scrapings, and so forth, yes, that's done before doing anything else. Obviously, if we're gonna be doing a sexual assault, eventually we're gonna have to remove any clothing such as pants, panties, and so forth to get to those, but as things are exposed, we will collect them at that point.
Once the examination, the external examination of wounds or the body, is there anything else about the external examination that you wanted to describe before I interrupted you?
We will do measurements. If we have obvious wounds, we will document where on the body they are, and I usually have a small worksheet I work from that I will do very crude drawings, cause I'm certainly not a trained medical illustrationist, but indicate, the type of wounds I believe them.
And that involves an internal examination. And that internal examination, does that allow you to see more full the extent of any wounds that are visible on the exterior of the body and perhaps understand the nature or the cause of death more fully?
It does. And again, this is, basically, a medical procedure, a dissection, as it were, where we open the chest cavity, the abdominal cavity, remove the rib cage anteriorly, so we can observe the organs in their positions, note how they appear, whether they appear normal versus disease versus disrupted from whatever cause may be going on. One of the last things we do after doing the chest and abdominal cavities, we will do the head, and we make incisions. And all our incisions are placed in ways that they can be camouflaged so as not to impede an open viewing during a funeral service. So the typical incision we use is a Y-shaped incision on the chest and abdominal cavity, although, the way I was taught, it's more of a goalpost, as opposed to a standard Y. The incision we make on the head is we go from behind one ear, across the top of the head, to behind the other ear. We can peel the skull or the scalp forward and back, take off the top of the skull to remove the brain, and then put things back.
Thank you, Dr. Kohr. How many autopsies have you performed in your professional career?
Right now, it's between 7,700 and 7,800, and I don't know the exact count at this moment.
And have you testified in court before?
I have.
And in a number of jurisdictions?
I've testified in probably a dozen to 15 jurisdictions in the state of Indiana, for different jurisdictions in the state of Illinois. I've testified by Zoom in the state of Montana, in person for civil cases in California, and in I believe 5 or 6 different federal courtrooms both in Indiana and Illinois.
In criminal cases, you've primarily testified on behalf of the prosecution.
I testify on behalf of whoever sends me the subpoena, and it primarily is the prosecution.
And you have testified, however, and been contacted and consulted with criminal defense. Is that correct?
That is correct.
I'm going to hand to you what's been previously marked as States Exhibit 123 through 137. Prior to that, however, let me ask a couple of questions directly, sir. Were you contacted in on February 14th, 2017, to conduct autopsies the following day, the following morning, in relation to the deaths of Libby and Abby?
I was.
And did you perform those autopsies on February 15th, 2017?
I did.
Showing you these images, would you look at these and tell us have you seen those before and do you recognize them and are they accurate depictions of what they purport to show?
I recognize them as photographs that were taken during the course of the autopsies of the 2 young women in my autopsy facility in Terre Haute.
I'm also going to show you a photograph, 222. Without displaying it to the jury, have you seen that before?
I have.
And is 224 sick? A close-up you cropped to show a portion of the injuries displayed on States Exhibit 135.
Yes, it is.
Would these photos assist you in describing to the jury your examinations and the opinion that you drew?
Yes, they would.
You were present when the state police crime scene investigator took a number of photographs. Is that correct?
The ones that we've just been shown to me, yes, I was present for all those. In fact, my hands or my body are visible in some of the photographs, as well.
And those included both external and internal examination photographs?
Pretty much.
Not these that I've shown you, but the ones that they took. You've reviewed those, correct?
Yes, I have.
And did you help select the ones that would be pertinent to your testimony?
I did.
And they do not include any internal examination photos?
Correct.
I would move the admission, Your Honor, that conditionally accepted, but not fully, of the photographs 123 to 137. In addition, I would ask leave of the court to move for the admission of the close-up photograph 222. States Exhibits 123 through 137 and 222 offered. 123 through 137. Did you say I said another number?
I heard 222 and 224. Are those? I just want to make sure.
222's the new one.
222 is the new one. I believe I misspoke.
Okay. All right. That's fine. May I?
Yes.
Judge, the defense would renew its objection based on 403, with the understanding that our position is that they're more prejudicial than probative, so we'd ask that they be excluded based on the conversation we had yesterday or maybe the day before at this point. Thank you.
And based on the completion of the foundation, I'll show 123 to 137 and 222 admitted over objection. States Exhibit 123 through 137 and 222 admitted.
That was 123 through 137 inclusive?
Yes, sir.
Thank you. Dr. Kohr, in this particular situation, the morning of Wednesday, February 15th, 2017, you did conduct 2 autopsies, correct?
Correct.
Could you describe to the jury what your practice is when you do multiple autopsies in terms of what you do once you complete the first autopsy, and in between intervening times between the two?
Well, generally, I follow the same approach regardless whether I'm doing one autopsy on a given day or 3 or 4. Once I have completed the autopsy itself, during the course of the autopsy, I first filled out my worksheet, which...
When you did, let's talk about the first autopsy you performed that morning. I believe it was on the body of Abby.
Yes, sir.
And did you note her height and weight?
We measure the height with a ruler, and this is literally length, rather than a height, because they're laying on the table, as opposed to standing upright.
And did you document the clothing that she was wearing?
I did.
What clothing was she wearing when she arrived at the autopsy?
There was a black hooded sweatshirt, there were a pair of blue jeans, a gray and black sports bra, and a rust-colored camisole.
Between the sweatshirt and the gray sports bra, was she wearing a garment?
The camisole.
The camisole?
Yeah.
When you conducted the internal examination of Abby, what did you observe that was of note to you?
If we're talking about the internal examination of the body cavity, it's really
external.
Okay, external. Once we got the body cleaned up enough to observe the source of the blood, because there was some significant blood on the anterior neck area, we were able to describe a solitary transversely oriented incised wound across the neck, predominantly on the left side of the neck. The way the wound first appeared when we measured it was 5 centimeters in length, or roughly 2 inches. Now, soft tissues being such as they are, when you make an incision across certain muscle groups, the muscle fibers underneath the skin.
Was that the only wound on the neck you observed?
It was.
Are you familiar with we spoke about the Indiana State Police Evidence Collection Kit? Did you utilize that kit in the collection of samples?
I did.
That kit includes a blood standard, does it not?
It does.
A vaginal wash?
It does.
What do you do in the vaginal wash?
Well, what we will do initially as part of this examination and what the kits are is it's basically the size of almost a small shoebox, but it will have a number of envelopes that are all numbered, as well as collecting devices such as Q-tips, syringes, things of that type. And we will just start pulling out the envelopes one by one and go first with envelope number 1 and see whatever it says is to be collected, and I think the first few have to do with things that can be just, hair plucked from the scalp, pubic hair pluckings, if.
So in addition to the vaginal wash, it would include a vaginal/cervical swab?
Yes.
An oral swab?
Yes.
An anal swab?
Yes.
External genital swab?
Yes.
Internal genital swab?
Yes.
Fingernail scrapings?
We attempt them depending upon what the length of the nails is on the person.
With regard to Abby, do you recall?
I'm trying to remember which of the 2 young ladies had it, but one of them had been a nail biter and we had very, very short fingernails, such that, and it was the case of Abby, basically the nails were so short it was very difficult to get any type of scrapings, because there really wasn't any surface underneath.
And as you indicated, head hair combings?
We will do combings to get hairs that are not officially attached that may have been transferred from another source. There is also combings done of the public hair and then pluckings from the hairs that will include roots, as well.
And these are all inside this box, the individual containers, marked with what the sample is to be.
Correct.
And you simply follow through with that examination, one by one, putting a sample collected.
Yeah.
In that appropriate envelope?
The evidence technician will basically hand me envelope number 1 and I'll see what it is, we'll collect that, put it in, he will seal it, and then move on to the next one in sequence.
Was there any indication of sexual injury to Abby?
I did not see any overt injury patterns such as abrasions, lacerations, contusions, or anything like that would suggest any type of traumatic sexual contact or damage being done to her genitalia, no.
Does that mean that there was no sexual contact or touching involved?
No, just it means that there's not enough to have left any type of wounds. Obviously, consensual sexual activity that people perform all the time does not leave wounds, and presence of various lubricants will also avoid having wounds left behind, but I could see nothing to indicate any type of trauma that was recognizable to myself.
Other than the wound that you described, the 2 and once it was spread, 2 3/4 inch laceration incised?
Incised wound.
Incised wound. What is the definition of an incised wound?
Okay. Well, it is one of 3 different types of sharp force injuries we see and describe in forensics. The 3 different types of sharp force injuries are incisions, which are shallow, they are longer than they are deep, and basically from drawing a scalpel across the skin or something like that will give you an incised wound. A stab wound is deeper than it is lengthwise, and so, basically, they tend to go down, but not leave quite as large a gap. And then the 3rd type of sharp force injury is called a chop, and usually it's got a sharp edge, as well as some heft to it. So you will see chop wounds, things like machetes, very large knives, axes, things of that type. In distinction to that, a laceration, even though it's commonly misused by everybody, including most people in the medical profession, a laceration.
And some prosecutors, apparently.
Well, including emergency room physicians and other people. A laceration is a type of blunt force injury. A laceration literally is a tearing of skin, causing the edges to separate, and there's a very distinctive markings that allow you to determine an incised wound from a laceration. A laceration will have an abraded or roughened edge. It may have bridging blood vessels or nerves when you try to separate it, but they have distinctive appearances that allow you to separate. So if I'm looking at a laceration, I don't want to waste my investigator's time looking for knives, because it was not a knife that caused a laceration and vice versa.
This incised wound on Abby's neck, was that the only wound you observed on her body?
It was.
Did you look for any defensive wounds?
I did.
Can you tell the jury what you mean by that phrase?
Well, with the assumption that a victim of an assault is conscious and able to respond, the natural human reaction is to try to protect themselves in a defensive posture, so if somebody throws something at you, you put your hands up. And we see this not just with, people coming at you with a baseball bat or a knife, but even with guns. People will try to stop a bullet with their hands just because it's an instinctive reaction. So when we talk in terms of defensive wounds, we're usually looking for injuries to the upper extremities, but we can also see them if they're, for instance, laying flat on a bed at the time. They may raise their leg up to try to block something, so it's trying to prevent something reaching their body, head, chest, abdomen, by something else such as an extremity.
Did you observe any blunt force trauma to Abby?
I did not.
Did you observe any bruising or any ligature marks or any other mark on her body consistent with restraint?
Well, we looked very closely at the wrists and ankles for those sort of things, did not see any. The only thing which we saw whatsoever that suggested a possible restraint or something being applied to the body was there is a very faint linear mark that goes across the face that almost looks like it's an edge of.
Was it more visible in a photograph than it was to you as you were there?
It was.
And do you believe that marking was post-mortem, pre-mortem, or at the time of the infliction of the wound to the neck? Could you tell?
Well, post-mortem could be any time following death up until the time that I do my autopsy. Pre-mortem could be any time before death. Things that are happening about the time, we often use the term perimortem, meaning around the time of death. Now, the fact that this is visible, it's faint, I really cannot tell with death, any type of definitive opinion as to whether this is perimortem or premortem. Less likely to be postmortem because I can't image a scenario why you would do something like that after a death, and that's more common sense than some sort of deep forensic scientific judgment. But that fact that it's so faint, but it's a little more prominent, would tell me it is probably in the perimortem period. The likelihood that it happened days or weeks beforehand is very unlikely, so this was probably sometime around the events surrounding her death.
What was the directionality of the wound to the neck?
The directionality, what we saw in the case of Abby was essentially.
And could you tell whether it was left to right or right to left from her point of view?
Not really with any certainty, but it appears more likely to be right to left, just because there were some abrasion patterns that kind of suggested where whatever instrument was, attached to the blade may have caused some scraping to the skin as it was drawn across, so my best impression most likely is that this was a right to left, going from her right to her left.
And did it damage any vessels in the neck?
It did.
Would you describe for the jury what you observed?
There was a partial transection of the left external jugular vein.
I'm gonna take this time to come back to Abby in just a moment, but I want to talk in terms of your examination of Libby that followed your completion of your notes on Abby. Is that correct?
Correct.
Was there neck vessel injury to Libby that you'll be describing in more detail soon?
Yes.
And what was the vessel injury to Libby?
In the case of Libby, we managed to cause injury to the right common carotid artery, which was a partial transection, a complete transection of the left common carotid artery and external jugular vein. So basically, 3 major vessels were injured by or in the course of what was inflicted on Libby. And just for clarification, transection means to cut through. A partial transection is.
Dr. Kohr, could you describe for us where the jugular vein is located?
All right. The jugular vein, obviously, it cannot be seen externally like you can see veins at the back of your hand and so forth, but it runs along a course right adjacent to the carotid arteries. Now, the easiest way to locate the carotid artery in yourself is you put your finger to the side of your neck and you feel the pulsation, and so basically, it's running right under the skin here, usually a depth of only about a ½ inch or so below the skin line. And again, this is basic anatomy that you learn as a freshman medical student, but it's also something, because I deliberately tie off those vessels for the convenience of the funeral directors. I've dissected these out and put the big strings on them, over 7,500 times during my career, so I examine these essentially every time I do an autopsy, so I know where they are. But again, they're not very deeply seated, as you can tell by feeling your own neck. If it was way deep, you wouldn't be able to feel the pulsation, but you can feel the pulsation because it's a fairly superficial vessel.
So the carotid artery, there are how many?
Well, actually, this is a quiz question that I give the nursing students that they usually get wrong. There are actually 3 carotid arteries on each side. There's what's called the common carotid, which is a branch up here, which then splits into an internal and an external carotid. The external carotid then distributes branches to the face and the musculature around the face and the muscles, whereas the internal carotid artery goes to the base of the skull and supplies blood to the brain. And so you've got common, internal, and external.
And the jugular vein is located where in relation to the carotid?
Well, right adjacent to the carotid. They're side by side. You gotta be careful, because if I don't dissect carefully, I may just cut the vein, which doesn't make the funeral directors especially happy.
What's the difference going to basic physiology? What is the difference between the vein and the artery?
All right. An artery literally is a blood vessel that's carrying blood way from the heart to the body part, whatever it is. In the case of the carotid, it's delivering to the head, neck, face, and brain. A vein is a vessel which is returning blood back to the heart. Arteries are in larger sizes, anything really above a capillary, are considered muscular organs. They have a layer of muscle, they're called muscular arteries. That way, they can constrict. When they constrict, they will cause raised blood pressure. When they relax, they'll cause lower blood pressure. And they have to be somewhat elastic, as well, because they've got to, the pulsation you're feeling is because they are dilating each time a heartbeat propels blood through them, so they are elasticized. That's one more reason why I tie the strings around them, because once I cut them, because they're elastic, they tend to, retract up underneath the jawbone, which again, makes the funeral director somewhat unhappy. Veins do not have muscles in their walls. They are very thin-walled vessels, almost paper-thin in most, including larger ones. The largest vein in the body is the inferior vena cava, and its thickness is about that of maybe 3 or 4.
Excuse me. Would counsel approach real quickly, please?
Sidebar conference.
I had to do interrupt, but we need to take a break. Several of the jurors are getting very uncomfortable.
Yes.
Thank you.
So maybe just put a pin where you were at.
Sorry?
IJUST said maybe put a pin where you were at with this particular witness, okay. We'll just take a break.
Sidebar conference concluded.
Ladies and gentlemen, we need to take a quick break. I know you've been over there a couple hours. While you are outside of the courtroom, please keep your minds open. Please don't form any opinions or conclusions about anything. You may discuss the evidence that you've heard so far, but please, only do that if all 16 of you are present in the jury room at the same time, and then, please, don't deliberate. Gentlemen.
All rise.
Jury out at 11:06 a.m.
All right. Let's take 15 minutes.
May we approach, Your Honor?
Yeah.
Sidebar conference conducted.
Was it something the doctor said?
No. It's just they've been over there for 2 hours.
Yeah.
And they were starting to eyeball Jeremy and Jason that they had to go.
Inaudible.
Yeah.
Appreciate it.
Yeah, no problem. Okay.
Sidebar conference concluded. Off record at 11:07 a.m. On record at 11:26 a.m.
All right, Mr. Lutt. Oh, we have no defense lawyers. Are you ready?
I am.
Okay.
Sorry, Judge, I thought you said 30.
30? I said 15 minutes.
Excuse me. The court no. You're fine, you're fine. And I know people have been complaining about the sound. I can't do anything about the sound, people. I'm trusting that the members of the media that have been provided with the best seats in the House are able to hear and can relay that information out to the public. It's important that these jurors hear what's going on and that the
All rise.
Jury in at 11:28 a.m.
Thank you. You may be seated.
Thank you, gentlemen. You may proceed, Mr. Luttrell.
Thank you, Your Honor. I'm gonna hand you State's Exhibit 223 and ask if you're familiar with that document, sir.
I am.
And what is it?
It is a schematic drawing of the major vessels in the neck of a human, which I helped select as a potential demonstrative exhibit.
I'm handing you what's been marked as 223A and 223L. Are those the same diagrams, schematic drawings, with you noting the location of neck injuries on both victims?
They are.
And is 223A designated as Abby?
Yes.
And 223L is Libby?
Yes.
Would move the admission of 223, Your Honor, and 223A and 223L. States Exhibits 223, 223A, and 223L offered.
No objection.
All right. Without objection, 223 and 223A and L are admitted. States Exhibits 223, 223A, and 223L admitted.
I would like to publish, Your Honor, the exhibits that we've entered through Dr. Kohr, and if I could ask him to come down towards the screen and proceed through those exhibits.
You may.
Thank you. States Exhibits 223, 223A and 223L published. 2 things, Dr. Kohr, or 3 things. I'm gonna hand you this pointer, ask you to stand to the side as much as you can, so that the jury can see the screen, and then ask you to project your voice to the back of the jury jurors, if you would, as you proceed. We're looking at States Exhibit 223, and you described injuries to the carotid artery and jugular vein on Libby and then on Abby, the injury to the jugular vein. Would you, beginning with Libby, would you show the jury where you saw transected vessels?
Of course, I have to make sure I don't mix the names up here.
On Abby.
Okay, on Abby. Abby's the one with the single defect. Now, just for anatomic reference, the 2 large blue structures here and here indicates are the external jugular veins, very thin-walled structures, but they are literally drawn in proportion to their actual size. These are, essentially, the diameter of a pencil, if not maybe a little bit larger. Her injury was right about here, in this general vicinity, so a partile transection of the external jugular vein, or the jugular vein, excuse me.
About how far below the skin's surface is that jugular vein at that location?
Roughly a half of an inch.
I'm sorry?
Roughly half an inch, maybe give or take, W, an eighth or a quarter of an inch.
In terms of Libby's injuries, would you show the jury where they were located?
Okay. In her case, we have a partial transection of the carotid artery right in this vicinity and then complete transections of the vein and the artery on the left side.
And did you note those on a copy of this schematic?
I did.
That I just showed you for the jury?
I did.
I would ask opportunity, Your Honor, to copy those and provide them to the jury at a later time.
So you would be talking to 23A and L?
Yes, Your Honor.
Okay. You may. States Exhibits 123 through 137 published.
Let's talk about the photos related to Abby. Is this a photograph taken after the sweatshirt was removed but before any cleaning of her body?
Yes. And you can see the white material here is the body bag, which is a plastic/vinyl tape of material. We've taken off the sweatshirt. We've still left on the camisole and the sports bra is still underneath that. We've, obviously, not cleaned away any type of blood residue, as we see it on the arms. We see it kind of obscuring what's going on here. We do see some pools and dried blood there.
Sorry. When you touch the screen.
Yeah.
It reacts to that, and I apologize.
All right.
Okay.
Also shows there's no types of injuries, obviously, here or anywhere on her forehead. And this looks more like a smear type of injury, as opposed to a direct transfer, like a bloody hand wiping that way, so this is more likely from clothing coming off, and that's one of the problems we get when we remove clothing that has to come off. Sleeves, if there's blood on the higher up and it's pulled off, it sometimes will transfer. Okay, in this photograph, we have taken off the camisole. You can see there's a gray sports bra here and then a black brassiere underneath that, as well. We still have not cleared away any type of blood residue, so it's kind of hard just to tell exactly where the wound is. Does have earrings in place. Mouth partially open. And again, we have some transfer blood here on the arms and into the body bag area.
Next photograph, is this displaying the gray sports bra has been removed?
Yes. Again, we are kind of stepwise we remove clothing, so now the gray sports bra's removed, showing us the black brassiere.
This photograph of the measuring device, the ruler, is showing what?
This is showing inches. I can tell that because the way the markings are, as opposed to centimeters, but we see the wound. We've got a very sharp demarcated end here. Over here, we have a slight abrasion, irregularities of the skin, and that tells me there's been some sort of blunt impact here, possibly as the weapon was drawn across it. We also see that the wound is gaping, and that's what I described earlier, because the muscle fibers underneath the skin are gonna be pulling it apart. So this is the wound as it's been cleaned to show the edges, but kind of misrepresents the total length of the wound in this dimension because of the fact that it's gaping in that way.
Which side, just for clarification, which side is Abby's right side of her body?
I believe her right side is here, indicates, and this would be her left side.
Indicates.
And your opinion was that the injury you believe went right to left, although you said it was not.
It's not definitive, but that's the more than likely explanation because a weapon with a hilt or some blunt, a handle part would more likely cause it on this side if it's being drawn left to right, or, right to left, as opposed to be drawn this way where you have to have a blunt impact before the blunt impact which strikes the skin.
How deep was this injury?
This injury is only in the neighborhood of maybe an inch deep or so at most.
Was there any damage behind the jugular veins that you noted, any injury to any other part of her anatomy?
Well, you can see there are some muscle fibers here and here, indicates, that have been cut across that are called the strap muscles in the neck, which give your neck your ability to move it in various positions. The fact that it's only a partial transection, not all the way through the vessel to anything underneath it would be very difficult to explain, cause you'd have to cut the vessel, sneak around underneath it, and then cut things deeper to it. So basically, this came across, went through muscle and part of the thickness or the diameter of the jugular, but didn't do any other significant damage. Obviously, cut through fat, as well, though, minor blood vessels, which are gonna be here under the skin, commonly labeled, superficial incisions or whatever cause bleeding.
You stretched that wound at some point and had it photographed.
I did.
And what was the purpose of that?
Again, to show what the without this gaping in this orientation would do to reflect more accurately the actual length of the wound.
And I believe that's our next photograph. Is that what you're doing here?
That's what we're doing. So these are my hands and my fingers pulling the wound about as taut as we could get it. Again, you can see the abraded edge here on this side and the slight discoloration, none of that on this side as we draw the wound. Pulling it this way, it allows it to kind of flatten out and be a better representation what the actual length of the incision is.
This photograph, we're looking at the lip, top lip, and then below the bottom lip, and then just at or below the chin. Would you describe to the jury what you observed in this photograph?
Well, we can, obviously, see for reference where the mouth is, the front teeth. We see some very, very minor abrasions of the lips. We can see the wound down here on the neck that went from the left side to the right. We can see here, parallel to this line, Sorry. Parallel to here, you see there's this very, very faint reddish mark here and a very faint. Very faint reddish mark here. So having one here indicates, and those are roughly I'd say about 2 inches in width, so again, that would be possibly consistent with something like duct tape, although there's no residues, glue residues like you'd see with duct tape. It could also be caused by a cloth or something else that's caused a very straight, very uniform line across there. The fact that these are below the mouth, as opposed to above, it would suggest that the mouth was not covered over by whatever this was.
This photograph is showing Abby's back.
This just shows that, obviously, she had been exposed to various dirt on the, floor of a wooded area where she was found. The purplish discoloration we see here and that we see here on the backs of the legs is something called livor mortis. That's LIVOR. It's caused by, it's a phenomenon of gravity causing blood to settle in the tissues underneath the skin. She was laying on her back for a long period and that's gonna settle to her back. Had she been found face down, we'd expect to see this on the front. That just kind of reiterates the fact that she'd been laying in this down on her back position for a prolonged period of time. You see that in certain areas, like here and here, we have clear areas. That's caused by the folds of clothing that prevent blood from settling in those capillaries cause of the pressure. You also see some sparing of where the buttocks were in contact with the surface, as opposed to right above on the thighs where the blood can settle. So we have pressure preventing the capillaries from dilating, you will not see liver. And then the areas adjacent to it where the gravity is not impeded or displaced, you will see the liver. So again, was on her back. We've got clothing indications here and possibly here, as well, so she was on her back from a prolonged period of time after death, and generally, for this to become visible it takes several hours. For it to become fixed, whereas if I push on it with my thumb in the morgue, it has to have been there at least about 8 hours.
This is simply her lower extremities, the same that you were describing, is that correct?
Yeah, just for completeness.
In terms of the examination of Libby's autopsy, just a few questions before we proceed to the photo documentation. You indicated height and weight for Abby. I'll put your notes closer to you, sir, for you to reference if you need to. Can you tell the jury the height and approximate weight of Libby?
Well, again, as I mentioned, we measure length, rather than height, so there may be some very slight differences there, but, as I indicated earlier, 64 inches in length, 5 feet 4 inches, and I estimated at her weight at approximately 95 pounds.
That was Abby, is that correct?
That was Abby.
And on Libby?
In the case of Libby, also 64 inches, and the estimated weight was 200 pounds.
Did you follow the same procedure that you outlined in which you do an autopsy, and which you did Abby's autopsy with Libby's?
Yes, I did.
And this is after Libby's body had been removed, the autopsy had been completed, the body removed. Is there a cleaning process that takes place between autopsies?
Yeah. One of which, once I leave the room, the autopsy assistant proceeds to return the organs to a plastic bag, which is then placed back in the body cavities for burial. The incisions we make, they shaped incision and scalp incision, are sutured shut by the autopsy assistant. The body is washed down of any extraneous blood materials that might be there, placed back in the body bag, and then returned to the body cooler for long-term preservation. Instruments are then cleaned, rinsed, the table is washed down so we should not have any residual blood of significance anywhere on the table. Once that's done, all the containers with various samples are labeled properly to make sure they're not cross-contaminated or mix up samples. And all this is taking place while I'm back in my office working on my report. When I'm finished with my report and they finish with the cleaning and we a break for quick something to drink or whatever, then we're ready to start the second case.
Dr. Kohr, in your second autopsy, the autopsy of Libby, did you conduct the same Indiana sexual assault collection kit process with Libby's body as you did with Abby?
Yes, we did.
Did you find any evidence in your examination of sexual trauma?
Again, I saw nothing that was visible to my naked eye examination.
Were there other swabs collected, items collected by the crime scene investigators, in addition to the Indiana State Police collection evidence kit?
Not to my recollection. Basically, we just followed the protocols, which is go through the bags as they're labeled 1 through whatever, and then those are packaged, sealed, and secured.
If there was testimony that there was swabs of breasts or swabs of areas of Libby's body, could that have happened?
It could have happened. There are, within the evidence collection kits, things for extra miscellaneous, and of course, those would then be labeled specifically of what the source was. I just don't recall things. It's been more than 7 years ago we did this autopsy. What, if anything else, may have been collected beyond the labeled ones for the various sites, such as mouth, genitalia, etc. But there are extra envelopes there for extraneous things that may be apparent or desirable to be collected by the state police based upon their information.
Did you find any defensive wounds or wounds that could be related to physical restraint on the body of Libby?
I did not.
She had how many incised wounds to her neck?
I be certain of at least 4 different wounds on her neck. And I thought that there may also have been a 5th. Some of these overlap, but there's definitely at least 4.
And they were large wounds, is that correct?
Well, they are similar size and similar appearance as to what we had seen in Abby.
The one of the wounds or 2 of the wounds, were they connected in any fashion or overlap in any fashion with each other?
Yes, they are, and that's why we say, even though it looks like, to the first glance, that there's only 3 wounds, when we look at the wound edges closely, we can see that there is basically a point to either end. Essentially, what we have is a very collapsed sort of X sort of a para-NCE, but we're able to see that there is different sites of insertion or beginning of incised wounds by whatever weapon was used.
We'll go to the first photograph. This is prior to any cleaning of her body, correct?
Correct.
And on her hand, what did you observe there?
Well, paper bags are frequently used by various police agencies at the scene to protect physical evidence under the nails or anything else that might be present. Paper is used, rather than plastic, because plastic retains moisture and you can get condensation and then, inaudible, of evidence. Paper allows some breathability and keeps things dry, as opposed to having, again, condensation and runoff that may contaminate things. And then, those are sealed with tape. And then, to take these off, we'd cut through the tape, pull the bags off, and then note the hands separately.
And that would have been done before any cleaning?
That was done before any cleaning, yes.
Okay.
Because if we start cleaning, we risk getting the bags wet by water spraying or whatever, so we want to do this when they're still in kind of a dry, pristine state.
Let's move to the next one. This shows the farthest right wound incomplete and the middle wound. What can you tell us about this right side wound on Libby?
Okay. For reference, right down here we see the right earlobe. We know this is right side of the body. We see the wound here, and what we see here is this little pointy tag. That's why we can say there's 2 separate applications of whatever type weapon was used. And because that sticks out there, one had to go this way, one had to go that way, or, whatever direction they were traveling, but that tag should not be there if it's just a single, passage of whatever instrument was used to cause the wound.
So that suggests to you that's 2 wounds there?
It's 2 wounds, and again, they may have been just trying to make a deeper pass the second time, but was not exactly on track, and the result, we've got just a slight deviation off to the side, so I can't tell whether this was from the first and this was the second or vice versa, but there are 2 overlapping wounds here.
We'll move on, but I want to note in this photograph and the portio and of right shoulder, not far from the collarbone area I guess, what is that?
That is a very superficial, an extremely superficial type of probable incision. It really doesn't go through all the layers of the skin, so a very minor injury of really no significance.
Other than abrasions noted on her leg, did you notice any other injuries to Libby's body besides what's depicted on her neck and that injury to the right shoulder?
Yeah. You've got a very tiny, minute abrasion here, very minute one here, maybe a millimeter in dimension, if that much.
Just below the neck?
Yeah, right here. Indicates.
Okay.
And then, we've got a couple of very superficial types of probably more abrasions than incisions, but other than what we're seeing in this photograph, I saw no other significant injuries.
Next photograph. This is that injury that you indicated the most, the portion of the injury closest to the right ear.
Correct. Again, here's the right ear, and this was what we pointed to earlier, the one pointy part sticking out here on the opposite side. On the far right side, you can see there's a companion. So again, we've got one wound is kind of gone this way and the other that way, so we've got, again, a very narrow X-like pattern over here, but definitely to get this and this, you'd have to have 2 passes of whatever caused this wound. And I've used my forceps here just to kind of accentuate and show that this is definitely there, so it doesn't track with the elasticity of the skin.
Move to the next slide. Now, this shows more to the center and the left side of her neck. Is that correct?
Yes. This is the wound that's just been described with the little tag kind of out here, and then this is our next wound, and again there is almost a suggestion of a tag coming out here, so that's why I can't be 100% certain that this wasn't a 2-pass, as well, which would make it 5, but I can't say with certainty, since there's only a single point of separation here. We see in this area, obviously, hemorrhage. We see the fat that's been cut across. We see bundles of muscle tissue which have been cut across. Again, there's a suggestion this may be a second pass of the instrument here.
Dr. Kohr, in your experience in conducting autopsies, have you done many autopsies with stabbed and incised wounds?
Yes, I have.
Can you tell the jury anything about how the victim reaction to an attack can affect the nature of the wound?
Well, assuming that the victim is conscious and able to mount some sort of defense, usually they don't just sit there passively while they're being attacked. So if someone's trying to cut you or stab you, you're going to be moving your body, trying to get out of the way, and defensive posturing. But again, if you try to turn away and avoid, that could affect, especially if the blade has already been inserted or an incision made, as you draw away, that may cause things to be accentuated or create artifacts. Now, one class I see artifact you will see, and I don't have something really good here to demonstrate with, but I will take my 2 fingers if this is a stab wound. If I go in this way and then my body jerks or the person that has stabbed me twists it and then pulls it out, I make what looks like an L-shaped or right-angled wound. It developed from a single wound, as opposed to going in once, going in a second time. And so we can see artifacts like that because of the body moving and pulling away and causing things to be extended. Again, it's very unusual for the body to remain perfectly upright. We see that also in the case of gunshot wounds, for example.
Okay.
People don't just stand there like this to be a target and will move and will change the inaudible. If our prosecutor here, Mr. Luttrell, is shooting at me, you would expect for them to go straight through front to back, but they may go left to right, may to right to left, depending upon what position my body's in at the time the wound was being inflicted.
Thank you, Doctor. Next photograph. Now we're seeing more directly the left 2 or 3 wounds.
This is the most prominent, this is the center of the 3 wounds, and again, this little tag here. Again, it is really now strongly suggestive that this may be a double passage on this one. And now we're seeing the 3rd wound, which is farthest to the left, this being the left here. Indicates.
And this shows the 3 large areas of incision, but they are 4 and possibly 5 incised wounds there?
Correct.
I want to focus on this portion. I don't want to go back, but I will very quickly, to this area most right in the photograph, the injury. That's the area that being focused on in the next slide. Is that correct?
Correct.
And while the photograph loses some clarity in this position, did you examine in considering that those 5 marks there, what did you conclude about those?
My initial impression was this resembled something like a serrated type of pattern, like you would see from a serrated knife like we use in our kitchen that has the scalloped edges. There's one here, one here, one here, one here, whereas this one is a little bit different in nature, so I'm not sure this is the same type of injury. Now, the problem, as I tee-hawed about this more as more time has gone by and I studied the photographs, is a typical serrated knife will have the deepest part to touch the skin would be kind of in the center and we should then have clearing on the other side, whereas on this side, we have almost 2 parallel lines here of reddish with a spared clear area in the center, and so that kind of, the more I've looked at this over the last several months in preparation for the trial, the more I considered this, probably is not from a serrated blade, but from something else associated with a blade or a handle of a blade or the hilt, just because the nature is such that we don't have any single deeper portion through the center of these, but almost a sparing area there. So these are more like abrasions than a serrated scraping type weapon across.
And so the distance between those 2 lines was that, as you consider it and look at that photograph, the distance between those 2 lines, is that part of your form part of your opinion?
Well, if we're talking primarily the width of these marks. Each of these marks is about 1 millimeter, maybe 1.5 millimeters in width, and they're separated by several millimeters between each one, so we've got a marked head separation of normal skin, a marked separation of normal skin, a marked separation of normal skin, whereas this one doesn't have that central pallor like we're seeing in this classic one in the middle, so that's why I'm thinking this may be something entirely unrelated from a different part of the weapon or from a different mechanism.
In fact, you were deposed by Mr. Razi and Mr. Baldwin back in February of 2024. Is that correct?
Yes.
And did you had put in your report says a serrated edge?
I'll object to leading.
What do you I'll withdraw?
Sustained.
The question.
Okay.
What do you recall about what do you know what your report estimated in terms of a serrated edge?
Specifically, my report used the word serrated edge, but that's on the face sheet. Later, in my...
Sir, you need to be by a microphone. We're not catching you. There's a microphone back here.
On my face sheet summary, I used the word serrated. On the separate paragraph on page 3 of the autopsy report, again, I used the word serrated, but as I recall from a deposition when this was discussed in detail with Mr. Razi, by that point, I was saying more, it's not a typical serration, it's not a classic serration, but serrated-like, and so that's, I guess, the clarification I made later on.
In your deposition, did you reference to Mr. Razi and Mr. Baldwin that the 5 marks there just above that wound, adjacent to that wound, could have been caused by something other than another part of the knife?
I believe I did.
And in your opinion, what part of a knife or sharp-edged object could leave that type of mark?
Well, most knives are not just a steel blade without anything around it, because you gotta have something of a handle, so you don't cut yourself handling the device, especially sharp knives, whether it be a steak knife or other kitchen knife. They can have wooden handles, the wooden handles can have marks on them in various patterns. They may have plastic or other types of hilts to prevent you from pushing it too far or having your hand slide down past the handle of the blade itself. There can also be, sometimes, plastic-like grips, depending upon the type of weapon. One of the things that I encountered as I was ruminating about this over the last several months was on my own workbench in my own garage, and I happened to have a box cutter that I've said for various applications around the house. It just so happened, the box cutter has, on the side, a plastic attachment, rubberized almost, that actually has several parallel lines for a thumb grip to keep you from having the thing slip out of your hand, and this somewhat resembles the size and pattern of what those thumb grips would be on a box cutter. And so the more I thought about this, considered possible causes, I'm thinking that this may, indeed, be related to a box cutter side, but it could be something else similar attached to the actual blade.
Dr. Kohr, I'm gonna ask you to return to your seat at this time, and you may take your reports with you. Let's talk about the first. I want to go through the symptomatic, or the physiological effect of these injuries. Let's talk about Abby first. When this wound was received, what would have been symptomatic or her body? How would it respond to this injury?
Well, obviously, the first thing you're gonna do is you're gonna feel pain because of a sharp instrument being passed across your skin, breaking through the skin and the deeper structures. Now, from a mental standpoint, I cannot predict how an individual's gonna react mentally, but in an attack mode, they're gonna, have some basic physiologic response, the fight or flight mechanism, which is called the autonomic response. Heart rate's gonna go up, blood pressure's gonna go up, breathing's gonna become more rapid. Whether or not panic set in depends on an individual. Immediately, because of this being a venous injury rather than an arterial injury, we're gonna start to have bleeding, and the bleeding is gonna be not under pressure, but more of a passive blood flow. Now, certainly, this is a large blood vessel, as I mentioned, they're gonna be similar to the diameter of a pencil, so you're gonna have blood flowing away, but it's gonna take some time before you lose enough blood volume to then have some of the more late-stage effects. As blood volume decreases over minutes, heart rate's gonna try to compensate for the lack of blood volume, blood pressure may start dropping gradually, and eventually, again, we're talking many minutes as the blood volume is dropped significantly, then we're gonna start having onset of shock. Now, shock is a physiologic response to dropped blood pressure, heart rate changes, and so forth. Eventually, certain organs stop getting the amount of blood they need to maintain function. Your body automatically shifts blood away from less vital parts of the body to more vital parts, so it'll preferentially constrict the blood vessels in the intestines, for example, because they really don't need blood in this situation as much as the brain or the heart might. So the brain's gonna continue getting the lion's share of the blood supply to the point where it drops enough, blood pressure drops enough, heart rate drops enough that you're gonna lose consciousness. Once consciousness is lost, person's not dead immediately, but we're reached a level of oxygen delivery of the brain where it cannot sustain normal function, so once the function drops off, you become unconscious and, eventually then, you continue bleeding until the brain actually shuts down and death ensues.
Dr. Kohr, can you give in your opinion, can you give a range of time that it would have taken for Abby to, once she received that injury, to be either unconscious or deceased?
This is really a crude, ballpark estimate, because there's no way to be absolutely sure. If she's sitting still, doing nothing, it's gonna take longer than if she's running around, being active. And, standing upright's gonna cause less blood flowing from here, as opposed to laying down, just because of the effects of gravity. But we're probably talking, to lose enough blood from this sort of injury, at least 5 to 10 minutes, maybe a little bit longer. So again, it's not gonna be something sudden by any stretch.
If she were laying down, would that be a shorter time than if standing up?
It should be, yes, just because the laying down is gonna have a lot of blood backing up into the veins and flowing away, as opposed to being upright. Blood's gonna be more likely to pool in the legs if you're upright.
Unconsciousness could occur sometime before that time range that you described today. Is that correct?
Well, that's.
Object to leading.
Sustained.
It was a leading question.
It was, I agree. The unconscious would I withdraw the question. Thank you.
Thank you.
In terms of the injuries to Libby, once these injuries had been received, do you have an opinion on the similar issue in terms of what would her body's reaction be in terms of how long would it be until death?
Well, the same sequence is occurring. We're having blood loss, which is gonna cause the autonomic response, elevated blood pressure initially, elevated heart rate, increased breathing rate, but because we've hit 3 different vessels of considerable size in this case, blood loss is gonna be more rapid, and as the blood loss is more rapid, we're gonna be then proceeding to the stage of shock more rapidly. So these things are all going to be accelerated just because we have 3 bleeding sources, rather than 1. The fact that we're dealing with arterial bleeders, as well, those are under pressure, not passively flowing, and so bleeding's gonna be even more rapid because of an arterial bleeder. The time.
When you conducted the autopsy, sir, did you observe any blood on the hands of Libby?
I did.
And is there a normal reaction by a victim to a neck wound?
I can't say what's normal, but the instinctive reaction's gonna be the fact that any type of thing that's bleeding, you're gonna try to stop the bleeding by applying pressure. And so whether you've cut your arm or you've cut the back of your hand or like I cut my thumb yesterday doing yard work, I'm gonna apply pressure. But again, if you got bleeding from the neck, you're gonna try to stop the bleeding to the best degree you can. That's basic first aid, Cub Scouts, Boy Scouts, Girl Scouts all learn, but yeah, you're gonna try to stop the bleeding. That would explain why she has as much blood on her hand as she does.
And can that slow down an arterial bleed and applying pressure to the neck? Can that affect the blood loss?
Certainly.
Do you have a range of time that you can give in terms of when you think death would have occurred with Libby?
Again, we're talking 5 to 10 minutes as a crude estimate. Maybe, in her case, closer to the 5 minutes, just because, again, we've got 3 vessels that are bleeding aggressively. I don't know how well she applied pressure, how well her, application was. It's one thing if I see a patient on the table in the emergency department and I can see where the bleeding's coming from to apply pressure directly to it. It's quite another thing if I'm bleeding from my neck and I'm just blindly trying to grab where I think the bleeding might be. But again, 5 or 10 minutes is probably the best ballpark estimate I can give.
You found evidence of cerebral edema in the body of Libby and not in Abby. Is that correct?
That's correct.
And I don't want to go into great detail on that, but what can you summarize for the jury in terms of what that told you?
Well, cerebral edema literally means swelling of the brain, and there's a couple ways we can look at that at an autopsy, one of which is the weight of the brain, and normal adults should have a brain weight of no more than 1,500 grams, and so when we see some that are 16 or 1,700 grams, then that's kind of a very simple call. The other things are a little more subtle and they involved as the brain, and again, we've all seen pictures of kind of what a brain looks like. It's got the hills and valleys. As it swells, the valleys tend to get squished together and the hills get plumper, and because the brain is encased in a solid, bony structure, it's really got no place to go, so as it swells against the confines of the skull, the hills get flattened, the valleys get squished, and it has a little different appearance than a normal brain. Instead of having some, more or less, dead space around the brain, it gets all kind of squished together. Now, cerebral edema can be seen in a number of situations. It can be caused from closed head injuries, but it can also be caused by anything that reduces the amount of oxygen getting to the brain. So if I have a drug overdose, if somebody's strangling me slowly, if I've had something else that's caused blood loss, as the brain gets less and less oxygen, one of the few responses it does is it starts swelling, retaining fluid. And so, generally that's an indication that there's been some survival for at least several minutes after the initial injuries occurred. It's not something that happens instantaneously, but develops over several minutes.
Dr. Kohr, are you able to determine time of death, the time going back from the time of the autopsy that occurred on Wednesday, the 15th at the first autopsy, 8 a.m., can you, with any precision, determine time of death?
Precision, no.
Dr. Kohr, was the condition of Abby and Libby's body consistent with having died 41 hours prior to the autopsy?
Yes, they were.
I have no further questions, Your Honor.
Mr. Razi.
Thank you, Judge. Nice to see you, Dr. Kohr.
See you, sir.
So you testified in the state of Indiana and the state of Illinois, and you said even virtually in Montana. Is that right?
Yes, sir.
And I think when we talked before you told me that you testified about 98% of the time on behalf of the state of Indiana, right?
Well, I wouldn't say when you throw in the Illinois counties, it's probably closer to 90%, maybe 10% in Illinois and elsewhere.
You told me 98 when we talked.
Well.
Here when I took your statement, right?
That's quite possible, yes.
Okay, and just to make sure we're all clear, you and I and Mr. Baldwin and the prosecutor were sitting in this room here in the courthouse on February 27th, 2024, weren't we?
I believe that was the date, yes.
And on that date, basically, I conducted myself and Mr. Baldwin conducted an a deposition, I should say sorry about that, a deposition of you in that room, right?
Correct.
And in that room, there was a court reporter that was with us?
Correct.
And that court reporter administered an oath to you before we started that statement, right?
Yes, sir.
And you swore that you'd tell the truth and the whole truth and all that kind of stuff, right?
Correct.
And you've done those many times, haven't you?
Yes, I have.
Probably hundreds, I'm guessing.
Yes.
And you would agree that you were questioned for a couple of hours in general?
Yes.
And that, at the end of that questioning, one of the options you have is to review that report, is that right?
Correct.
And you have the option of reviewing it, and if there are any changes that need to be made, you can make those changes, right?
Correct.
And then you can sign off on those changes?
Correct.
In this case, you chose to waive your ability to review that report.
After talking to the court reporter and she assuring me that she thought she got the overwhelming majority of the medical terminology correct, I did waive that, yes.
Now, let's talk about Abby first. You didn't reference any time of death on the autopsy report that you generated for Abby. Is that right?
That's correct.
And you don't know when she died, do you?
No, I don't.
You told me at the autopsy, strike that, I'm going to keep doing that. At the deposition, you told me that you know that she died sometime between the last time that she was seen alive and the time that she was discovered in that woodlet.
That's an absolute yes.
And that's about the best you can do?
Well, we can do a little bit better than that, but that's our beginning parameters, yes.
Well, you even said at 1.28 to 24 to 48 hours before she was discovered, right?
Correct.
And do you agree that, generally speaking, death investigations, from the standpoint of identifying time of death, can be very difficult and really challenging?
That's one of the biggest barriers we face in forensics, unlike what's portrayed on the various TV shows.
And you saw some photographs of the crime scene, either before or shortly.
I actually didn't see crime scene photographs until earlier this year.
Okay, but you saw them?
Yes, I have.
Before you took, we participated in this deposition, right?
I believe so.
Well, do you recall telling me that you really couldn't draw any substantive conclusions as to time of death based on those photographs?
Yes, I do.
Talk about the autopsy report on Abby. You told me during the deposition that you couldn't really say much about the type of instrument that was used to create the wounds on her, didn't you?
Well, we obviously described it as a sharp force instrument or a sharp-bladed instrument, but in terms of the exact type, whether it be knife versus scalpel versus whatever, I could not tell you specifically, no.
And, in fact, you said that you couldn't say anything definitively.
Correct.
Basically, what you could say was that it had a sharp edge, right?
Correct.
And you couldn't draw any conclusions about the length of the instrument that was used?
Correct.
And you said specifically that a person could inflict these types of injuries with anything from a pocket knife to a kitchen knife. That's what you told me, didn't you?
Correct.
You didn't say anything about a box cutter, did you?
Nope.
You said short-bladed instrument, long-bladed instrument. Either one of those could have caused those types of injuries to Abby.
Correct.
And there was no way for you to make a determination about whether or not those injuries were caused by someone who was right-handed or left-handed?
Correct.
And you said earlier, and it was one of the last things you talked about, Abby's injuries. It was an injury to her vein, right?
Yes.
And if I were being a student of your profession, I think you said that the blood is flowing toward the heart when it comes to a vein. Is that right?
That's correct.
So the pressure in that area of that vein, in this particular case, is much less?
Yes.
Whereas with the arteries, the blood is flowing from the heart, away from the heart, and so the heart's pumping that away, right?
That's correct.
'Cause that pressure's greater.
Right.
So a layperson would draw the conclusion that, because the pressure's less, you would just bleed slower.
Reasonable.
Was that the lesson you gave us all earlier?
That is, yes.
And so we talked at that deposition about how long this might have taken for her to expire, right?
Right.
And you agree that death certainly would not happen instantaneously with Abby?
Correct.
And you suggested that there would be a much slower pace of bleeding because of that level of pressure?
Yes.
And that there could be several minutes before sufficient blood loss would result in unconsciousness, right?
Right.
Not necessarily death, but unconsciousness?
Right.
And you even said it could be anywhere from 4 to 6 to maybe 10 minutes. It's hard to say, is what you said, didn't you?
Yes.
And so it is. Do you agree that it's fair to conclude that she may have had an opportunity to react to these injuries before she became unconscious?
Definitely.
To run around, to make noises, fight back, all those kinds of things could have been going on?
Correct.
Her trachea was not damaged, is that correct?
That's correct.
Which means that there was no blood flow or air flow restricted to her, right?
Right.
So she could have spoken. There's no reason why she couldn't have talked?
Not reason at all, no.
Could have cried. She could have screamed, any of those things?
Yes.
And so her ability to breathe basically had remained intact despite the gruesome nature of that injury?
Correct.
You said there was a mark on her neck. I could pull the photo up, but I'm not in charge of the technical stuff here right now. Do you agree that, well, strike that, I'm going to do it with another question. We talked about this mark that kind of went linearly across the bottom of her mouth. Do you recall that?
Yes.
And that was certainly not restricting her, whatever caused that, restricting her from breathing, right?
No.
But you think that that mark was created sometime around the time of her death, or that, which I think you said perimortem.
Perimortem, yes.
Pri mortem, right?
That's right.
Did you draw any conclusion that somebody might have placed something over her mouth? Is that your opinion?
It's a possibility. It could have been that, it could have been clothing tightly around there, it could have been any one of a number of different things.
Speculation is involved in that, right?
True, yes.
Tried to collect evidence from her fingernails, or, at least, you did, right?
We attempted. We weren't real successful because they were so short there's really nothing to be able to get underneath them to, but nonetheless, we scraped the base of the fingernails on each finger, yes.
But as far as you know as you sit here today, nothing of real value was obtained?
Not that I've been made aware of.
And there was no trauma to her sex organ, right?
Correct.
And as to whether or not she engaged in any kind of sexual activity leading up to her death, you don't have any opinion about that either way as you sit here, do you?
I do not.
There's certainly no proof that that did occur, right?
None that I'm aware of.
And there were samples collected from various parts of her body, in addition to what? I think you said maybe that there was, law enforcement was doing the same thing, taking samples, right?
Well, basically, we work in tandem. When we get the body to the morgue, I'm the one actually plucking the samples, for the most part, and handing them off to them to package and label.
Let's talk about Libby's autopsy report, okay? You said there were 4, maybe 5 injuries. You were having a hard time counting because of some of the physical circumstances, right?
Correct.
And again, kind of the same questions as before. You can't tell whether or not those injuries were inflicted by somebody that was right-handed or left-handed, right?
That's right.
A lot of issues involved with that, angles, and if someone's standing behind somebody versus in front of them, those kind of things, right?
Well, there's forehand versus backhand, there's, from behind, same things sort of go on, so yeah, there's really no way to tell.
Okay, and you told me that one of the differences in the wounds that you saw or the injuries to Libby was that there were these serrated marks that you just spoke about in some length, right?
Yeah.
You told me.
Affirmative response.
You shaking your head yes?
Yes.
And you used that word twice in your autopsy report, right?
Right.
On the first page, which is the cover sheet that contains all the conclusions.
Yes.
And then on page 3 at the top, this is a 9 centimeter in length and shows an area of serrations along the medial and lower edge of the wound. So that's the second reference you made earlier, right?
Correct.
That was one of the 3 or 4 or 5 wounds that you noted.
Yes.
Do you agree with me? Strike that. Did you tell me that that serrated area could have been caused by the handle of an instrument?
I believe so.
And did you tell me that it was possible that 2 different instruments could have been used to create those wounds on Libby?
I believe I said possibly 2, possibly 3, possibly 4.
And in fact, there's only one of those wounds where there are any of those serrated marks that even exist, right?
That's right.
And you don't see any of those on any of the other wounds?
Correct.
And the same is true with regard to Abby's wound.
Correct.
So that might be suggestive that there might have been more than one instrument?
That, or it could also be affected by the angle of insertion.
Or the force of it, right?
Correct.
But it might also be suggestive that there might have been more than one instrument?
That's a possibility.
More than 2.
Correct.
We talked about cerebral edema,
Yes.
and we discussed that that was the mild, or that was the swelling of the brain, I think is what you told the jury earlier, right?
Yes.
And that's significant here because it helps you determine whether or not there was any oxygen flow that was cut off to the brain while this process was occurring in general, right?
Yes.
So in other words, if there's more swelling to the brain, that means there was less oxygen. Somebody was either being, asphyxiated, or they just weren't able to breathe for whatever reason, right?
And that, plus the fact that there's a time element. It takes, obviously, a certain time for the cerebral edema to accumulate. It's not like an on and off.
Okay, but in Libby's case, the edema was mild. You noted it was mild. Is that correct?
Yes.
And that would also suggest that death was not instantaneous for her?
Definitely.
And we talked. You said she had at least a few minutes from the initial injury before her death, right?
Right.
And you told me specifically, when we got into talking about real times, it could be 3 minutes, it could be 10 minutes, even up to 20 minutes, didn't you?
Yes.
We talked about the fact that that injury, because it was to an artery, could have been cause for the projection of blood around the area where she died, right?
Yes.
And I believe we even got into some details about how far that could have been.
I believe so.
Maybe 6 feet or so.
It can be that way, yes.
You've seen some examples of that actually have happened?
I have.
You noted some debris on her leg?
Yes.
And you suggested that maybe she was drugged from another location. That would be indicative of that, the way that debris looked on her?
Based upon the appearances, yes.
There's nothing contained in either one of your reports that would help.
No, there's not.
Now, earlier, the prosecutor asked you. Mr. Luttrell was asking you some questions about these serrated injuries. Is that right?
Yes.
Actually, we'll leave that there for 1 second. I've noticed in the images that were offered up that the girls, I think both girls, correct me if I'm wrong, were laying on a white sheet. Did you see that?
Yes.
I've seen a few of these pictures in my day. Is it unusual was that how they were delivered to you was wrapped in a white sheet?
Well, oftentimes, there's a white sheet inside the body bag just to, keep blood from flowing out. It's gonna, more than likely, retain it so it doesn't get through the zippered ends. But yeah, that.
Does that happen in all occasions?
Not every single occasion. It depends upon the county, what their budget is, who collects the body, how they preserve them, but it's not uncommon, but it's not universal.
Do those sheets get reused sometimes?
They can be, yes.
Is there always a concern, when that's the case, that there could be some contamination because those sheets have been used for somebody else's body?
Well, generally the sheets that are used in situations like that come from a hospital ambulance, and the ambulance gets their sheet supplies from.
In this case, do you know if those sheets came from an ambulance?
I do not know for certain, no.
Do you have any idea where those sheets came from?
Well, generally scenes like this are removed from the SCE, or bodies at a scene out there are removed by medics or fire department personnel do the actual physical lifting and carrying. so it would usually come off of an ambulance or a, fire department vehicle. But again, that's what's usually done, and I have no way of knowing for sure what was done in this case.
You don't know where those sheets came from?
I do not.
So let's talk about these serrated marks again. After I took your deposition in February 27th, you apparently went back to Terre Haute and started thinking some more about these conversations that we had, right?
Yes.
And it sounds as if you were a little unsettled in your mind about what might have caused those serrated marks.
Well, as we discussed in the deposition and as I considered it, the fact that I think I said multiple times in the deposition these were certainly not classic serrations, they looked different, and serration was just kind of the best match I could think of at the time of the autopsy. But it's not unusual for me, after we do a case, after, speaking with various people, the more I consider cases, I'm preparing to come to trial and have to answer questions from prosecution or defense attorneys, and I try to consider things that may help.
And so you mentioned deserrations in the depot, that they weren't classic, right?
Correct.
But you didn't take an opinion about what type of an instrument was used when we took your statement back there, did you?
No.
And when you left this courthouse in February, did you ever contact my office again with any new information regarding your opinions in this case?
I did not.
Did you prepare any new reports that suggested, hey, I've changed my mind about what I said back in February under oath?
I have not.
Would that have been a reasonable thing to do with something this important?
Well, if I made a definitive call the first time, then it would have been appropriate. The fact that I'm saying that these are possible explanations is not quite at the same level, so it's not routinely that I would do such, no.
Did you talk to the prosecutor between February and now?
I have.
How many times?
I believe 3 separate occasions.
On any of those occasions, was it suggested that maybe you should?
No.
You don't have any way of knowing whether or not that injury was caused by a box cutter, do you?
Nothing definitive, no.
And there are lots of different kinds of box cutters, aren't there?
I've got 2 different types in my garage.
How many times have you testified in your life, if you could just estimate?
Combination of depositions and actually in court, probably 200, 250.
And how many times do you think you've walked into court? Strike that. How many times do you think you've changed your mind between the time that you took a deposition, a sworn statement, and the time you walked into a courtroom?
Probably 10% of the time, just because of new information coming to me.
And in any of those past circumstances, did you ever think, hey, I should prepare a report, because I've dealt with this before and the lawyer's probably going to question me about this?
There was one occasion, because I was kind of set up by the prosecutor in that case and it became necessary, unfortunately.
This case has got a lot of notoriety, hasn't it?
It does.
So much so that you even met with a reporter at one point a couple years back, didn't you?
Yes.
Sat and had coffee with that reporter?
Correct.
So you knew the significance of this case in terms of the attention it was getting from the public?
Yes.
You think it would have been a good idea to generate a supplemental report so that the defense would have had an idea that you were going to come in here and change your statement today?
Well, a supplemental report would have considered speculative ideas, as opposed to a definitive changing of statements that are on the report. So generally, if I'm going to do a report, it's going to be something that I've got definitive evidence to support, as opposed to speculation.
Do you think it would have been a good idea?
It might have been, but I can't say with assurance, no.
Either way, it's all speculation, right?
Correct.
Pass the witness.
Mr. Luttrell.
Thank you, Your Honor. What's the minimum number of knives that would have been needed to cause the at least 5 wounds between the body of Abby and the body of Libby?
Minimum number is 1.
Did you note on your report whether or not the bodies were received in A?
Would note that on my worksheets. In the case of Libby, she was received in a body bag. In the case of Abby, she was also received in a body bag.
Would the fact that there's an artifact, if that's an appropriate term, next to that one wound, the wound that's farthest to the left of Libby, would that, by itself, indicate that there probably was more than one instrument?
Not necessarily, no.
Thank you. I have no further questions.
Mr. Razi.
You don't know how many instruments were used, do you?
I do not.
Nothing further.
All right. Does anybody on the jury have any questions for the doctor?
No response or indication from any juror.
All right. Thank you, doctor. You may step down. All right. Well, ladies and gentlemen, we're gonna go ahead and take our lunch break. While you're outside of the courtroom, please keep your minds open. Please don't form any opinions or conclusions about anything. You may discuss the evidence that you've heard so far, but please, only do that if all 16 of you are present in the jury room at the same time, and then, please, don't deliberate. Gentlemen.
All rise.
Jury out at 12:38 p.m.
All right. Let's resume at 2 o'clock, please. Jody, you can go off the record.
Off record at 12:39 p.m. On record at 1:59 p.m.
We'd be calling Mr. Cecil next. I've got him in the courtroom, ready to go, Judge.
Okay. Could we get that screen OFF of there, since it has news?
Oh, Judge, I'm sorry.
Thank you.
I hope that doesn't pop up well, Judge. We've stipulated, I guess, before we bring the jury in, we've stipulated to the extraction and the reports from Mr. Cecil.
Okay.
I plan to use this one and I defer to Ms. Auger, but I can leave that popped up.
That's fine.
That's the first exhibit I plan to use.
Okay.
And I'll turn down the sound.
Okay. Yeah. I mean, that way, we just don't have any inadvertent media story about this case.
I agree, Judge.
That we've been trying very hard to keep from the.
I've been failing miserably with technology during this trial, so.
All right. Is the defense ready to bring the jury back in?
We are, Judge.
All right. Let's go, gentlemen. And you had indicated that that particular witness's testimony is like a couple of hours.
I think it's gonna be lengthy, Judge.
For direct.
There's at least 2 reports to go through. I don't know if direct will be a couple hours. I think total will be. It'll be lengthy.
Okay.
So is the court anticipating us calling additional witnesses after him?
Probably not, 'cause it's 2 o'clock.
That's. That was our hope, Judge, 'cause we're not really prepared for that, but.
All right. Well.
We're ready, then.
Well, then you've kind of forced my hand. Okay. All right. No, I mean, the morning was a lengthy morning for the jury, that's why we took a little bit more of a break for them to kind of decompress a little.
This is gonna be dense material is the other issue, Judge.
Okay.
And I want the jury to have an opportunity to absorb it all, I guess, is really the issue.
Okay.
All rise.
Jury in at 2:02 p.m.
Thank you. You may be seated.
Thank you, gentlemen. All right. Well, welcome back, ladies and gentlemen. I hope lunch was okay. We are ready to continue. Mr. Luttrell.
Thank you, Your Honor. At this time, I would like to publish to the jury copies of 223A and 223L that Dr. Kohr marked on relating to injuries.
Okay. You may. States Exhibits 223A and 223L published.
So each juror should have an A and a copy of an.
And an L.
Okay.